Hi, Dr. Ian from Onlay Dental. Some of our patients report quite a lot of confusion between some of the terms we use, and patients will tell us now they've got caps and they've got onlays and inlays and veneers, and what is the difference? So most of the work we do in general dental is direct fillings. So it's fillings that are placed inside the tooth, cured inside the tooth, and those have got some benefits and some drawbacks. And then from there on, in patients that need a little bit more of substance as far as stronger materials, we can go to some of the other options. Now, inlays is an indirect restoration. It means that it gets cemented in, it's cured outside of the mouth and gets cemented inside the mouth. So there is some benefits to that, and it is a stronger filling than the filling materials, and that there's less sensitivity with them than the filling materials. However, it's only in limited cases that we can actually use those, and the reason for that is that normally fillings that gets replaced, the preparation of the tooth structure is that we try and get the walls either as parallel as possible, or sometimes you get a bit of a undermining of the walls to keep the filling in, especially the silver fillings have got a lot of undermining of the walls, so you've got that shape of a material of the teeth coming out like this. Now, if we are to do a direct restoration, we need to have a plane of placement, so you need to open those up so you can cement something in from the top. Now, especially in the silver filling cases, then that tooth destruction is just sometimes a little bit too much to justify an inlay. So some of those cases are better off with a filling, because we don't destroy as much tooth structure. Now, on an onlay, it's a bit of a different. That's already when the tooth structure destruction has already taken place, before we try and restore it. So we don't sacrifice any additional tooth structure, and then a onlay will go on top of that tooth. And the reason for that is, especially if there's a few cracks in there, by going over the sides on the walls of the tooth structure, is when we chew, we go from side to side, more or less like this, and it puts these kind of shearing forces on the walls. Now, if we go with an overlay just slightly over, then we transfer the forces back into the long axis of the tooth, and we've got less of the side walls kind of shearing off, breaking off like that. And not only that, because these materials are indirect, they're pre-cured, they've got less shrinkage, they are quite a bit stronger than just a normal filling, and it does protect the tooth a little bit more without necessarily taking away too much tooth structure. So we believe that the ideal structure in your mouth is natural tooth structure, and any other filling material becomes a distant second best. So we try and maintain as much of the tooth structure as we possibly can. Now, in some cases we don't have much choice, and the cracks and the destruction are already of some significance, and then a crown might be considered. Now, a crown, it goes completely down to, at least most cases, to the gum line. Sometimes they're a little bit higher up, but in most cases to the gum line. Mostly that's done for aesthetics, to make the tooth look kind of like a tooth, not this line between the restoration and the old tooth structure. Now, these are indicated in some patients, especially with heavily worn tooth structure, with a lot of cracks, a lot of fractures. And they protect the tooth better, but at the cost of biological tooth structure, and they are a little bit more expensive. Those are the significant difference between fillings. It's bonded. All four of these options are bonded. Fillings are direct in your mouth. Indirect is inlays, onlays, and crowns.